It's July 15, 2025. I'm Dr. Duke Machen, CEO and founder of Duke Spine Institute. Another patient here with horrific back pain, and we're sloping the table a little bit on purpose, or that's all right. His back pain is right here, this area, marking pen. Typical location for lower back pain, sort of the L4-5, L5-S1. Lower back pain. He's got two discs here that have small tears on the left side, L4-5. You awake? All right, we're just giving you some medicine, some numbing medicine, okay? We're going to put you to sleep soon. Our patient has had back pain for, wow, stereo, 11 years. That's correct. Thank you, guys. You guys are awesome. On the ball. 11 years of back pain. And he is a patient who has another condition, multiple sclerosis, correct? And so he's actually in a wheelchair. His quality of life has really taken a big hit, but he's in pain all the time. So he found Duke Spine Institute, and we met, and once I evaluated him, I believe his pain is coming from his discs, the L4-5 and the L5-S1. That's right where his pain is. So we're going to do the Duke laser disc repair. He did not want open back surgery, fusion, laminectomy, that kind of stuff. He wanted something less invasive. Shot. And that's what he's getting. Henry,
Sir.
people with back pain, lots of different causes, right?
Of course, yeah.
As a matter of fact, there's about 30 different causes of back pain. So let's share with our audience the 30 most common causes of lower back pain. I'm Dr. R. Duke Machen with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us.
Welcome back. You can see from the video that disc injuries like herniated disc, bulging disc, ruptured disc, extruded disc, protruded disc, slip disc, degenerated disc are the #1 cause of back pain. 85% of patients with chronic back pain, their most common source is the disc. Now, we just tested this patient's 2 discs, L4-5, L5-S1. Both of them were 10 out of 10 concordant, meaning that's exactly where he gets his back pain. Folks, this is as good a news as we could possibly have today. This poor man lives in a wheelchair, suffering every day with back pain, excruciating. Think about that. You have to live in a wheelchair and your back hurts the entire time you're sitting there. I mean, how do you live like that? I couldn't live like that. But he has. His strength of character is amazing to me. And yet he found us because nobody else could help him in the world. He came to Duke Spine. We're going to get rid of that back pain right now. Henry, let's show the world how Duke Spine gets rid of back pain from a disc.
Of course.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. You can see from our video that the tear in the back wall of the disc gets a herniation stuck in it, and that's what causes back pain. Did we show them how we use the laser to fix it?
Yes, we did.
All right, we did, or we can?
We did.
Excellent. We're about to enter L4-5. This was a 10 out of 10 pain for this poor patient. 10 out of 10. He has a tear there. You could see it on the discogram. Any questions?
Yes, we have a question coming from Donna on Facebook.
Hi, Donna. Welcome to our stream. Facebook.
Yes, correct.
That's where, right?
Yes.
Nikki is laughing. All right.
Donna
Go
from
ahead,
Facebook
Donna.
asking, I have a right pelvis that tips forward. Do you think it is due to a tight piriformis muscle or an SI joint with hypermobility?
Donna, that's a great question. I honestly don't know the answer. I can't tell you what's causing your symptoms without doing what's called an examination. I must see you, and we offer a free MRI review for everybody out there. There's no charge. You get my time for free, all my experience, all my years of treating patients successfully. You get that for free, but you got to set up an MRI review. That's the only way I can tell you what's causing your pain or maybe what's causing your symptoms. Okay, we are at the L4-5 disc first. Remember, this was 10 out of 10 pain. And look at the blue. The blue is staining the degenerated nucleus pulposus. That's the source of his pain, is inflammation in the back wall of this disc. We're going to fix that for him so that he can have as normal of a life as he can. Seems very fast-paced. All right. You can't increase the energy per pulse. You have to increase the pulse rate.
We have a comment and another question.
Sure, just give me 1 second before
course.
we take it. Yeah, I was hoping, Nikki, that we can increase the energy per pulse, but are you able to do that? What's your energy per pulse? Oh, it is. Interesting. All right. So the only way to get more energy is to increase the rate, which you've done. That's fine. I didn't know that 3.5 was the maximum. All right, we'll take the question.
Question, and we also have a comment. The comment's coming from Smallville 1219 on YouTube,
Thank you, Smallville.
saying, hi, Dr. Duke, stopping by the stream to watch and say hi to you and the team. Hope all is well.
That's great to hear, Smallville. Thank you. Team is good. We're just carrying on. We so happy to be able to help these people. Our last patient, we did a cervical Duke laser disc repair just this morning, and she's doing well in recovery. Her whole life was just consumed and destroyed by her neck pain. She had a prior fusion done elsewhere in Virginia, where she's from, and that just ruined her neck, made it even worse. So she found us, her and her husband. They made it here to Duke Spine today, and she had her neck fixed. And hopefully that's going to get rid of all the pain in her neck that she has had for years and years. This gentleman lives in a wheelchair. He has multiple sclerosis, and he's just had back pain for many, many years. And we talked about how we could help him by repairing these two painful discs. And finally, he pulled the trigger on his surgery, and here we are fixing them for him. So it's a great day for our patients who are suffering, and now we're going to help them get out of pain. But thanks for stopping by and commenting.
This next question is coming from Donna once more on Facebook,
Sure.
asking, are the medial cluneal nerves cut with the Duke plasma rhizotomy near the SI joint?
No, we don't cut the cluneal nerves with the Duke plasma rhizotomy. All we do is cut basically the sensory nerves to the joint. There's somatic afferent nerves that come out of the dorsal foramen and the back of the sacrum, 4 of them, and then one of them actually comes out from the L5-S1 foramen. It's the L5 dorsal ramus. And that's the sensory nerves we're cutting. These nerves only go to the joint. Their only job is to bring joint pain from the joint to your brain so that you are aware your joint is hurting you. Well, when people have arthritis of the joint, it's always hurting, and we already know it hurts. We don't need to be reminded. That constant pain coming from the SI joint is very distracting, and it keeps people from enjoying life and doing the things they're supposed to do. Since we're on the subject of the SI joint, and Donna is asking questions about it, why don't we just show our video on the SI joint? Even though this patient doesn't have that problem, this patient has just disc problems. Let's share our sacroiliac joint Duke plasma rhizotomy video so that everybody can understand what it is Donna's talking about.
Sacroiliac joint injury is a common cause of chronic back pain. The inflamed sacroiliac capsule tear generates pain signals. The best treatment for sacroiliac joint pain is the Duke plasma rhizotomy. Sacroiliac joint pain nerves are destroyed. The advantages with the Duke plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Welcome back, folks. So we've just shared with you our sacroiliac joint Duke plasma rhizotomy treatment video. And for those of you who did not know it, the sacroiliac joints, there's a right and a left joint. They're just on the side of your butt crack, the top of your butt crack. The sacroiliac joints can be very painful. They become painful in patients who have injured those joints at some point in their life through trauma. Trauma means they fell or car accident or some type of sports-related injury, usually. But the sacroiliac joints can be painful for non-traumatic reasons as well. But most of the time it's some type of trauma. Anyway, if you have a diagnosis of sacroiliac joint pain, and it's coming from arthritis or degenerative joint disease of the SI joints, there are really no good treatments except for one. And that treatment is a new treatment. It's called the Duke plasma rhizotomy. Prior to the Duke plasma rhizotomy, the only treatments we had were shots, therapy, medication, and fusion of the joint. Now, shots were never going to give you lasting relief. They give you temporary relief of the pain in the SI joint. Just like if you have arthritis in your knee and you get a shot in your knee, it helps for a few weeks